Hello, I'm Ellen Kim and I'll be introducing our organization Healthyi today. Healthyi is a student-led nonprofit organization that aims to alleviate neglected tropical disease progression in impoverished communities through collaborations. With that established, here are some things I'll be briefly touching on today. To begin with, I'll delve into the problem or issue that is the focus of our missions. Second, what solution we propose to help alleviate this problem and how far we've come with our plans. And lastly, a brief look at our organization structure. So let's begin with defining NTD and the main issue centering the motives of our organization. Before though, take a moment to look at this figure. Here's a map from WHO that highlights the concentration of neglected tropical diseases, or NTD, in the world. The darker shade of green, the more people are involved in such diseases. The darkest green indicates more than 250 million individuals affected. So, what are NTDs, and in what ways are they affecting such an immense amount of people around the world? NTDs are a category of health problems that typically impact and distress the poor, but haven't gotten enough attention to result in a viable cure or immunization. The World Health Organization has classified 20 illnesses collectively as NTDs, the majority of which are prevalent in tropical regions, as the term implies. If not treated or detected in their early stages, many of these diseases can quickly develop into chronic conditions. NTDs mainly affect impoverished communities where transmission of diseases can happen through something as simple as taking a sip of unfiltered water or stepping on contaminated soil, causing devastating symptoms and health issues for more than 1 billion people worldwide, particularly juveniles. Referring to the map from earlier, it is notable that these diseases are most pervasive in sub-Saharan Africa and South America. In terms of medication, though not costly and easily accessible in countries like South Korea, pills are of hard reach in places of high disease rates. Now, out of these 20 reported illnesses, we decided to target the disease with the greatest impact on the Kaduna State, Nigeria populace: soil-transmitted helminths. STH, including ascariasis, whipworm, and hookworm, primarily infect humans through soil contact in moist, warm climates with poor sanitation, commonly affecting school children aged 5 to 13 due to outdoor activities and hygiene practices. STH eggs are excreted in feces, becoming infective upon maturation and capable of penetrating human skin. Diagnosis is challenging because symptoms are often absent. Anthelmintic medications like albendazole and mebendazole effectively treat STH, with albendazole being more preferable, showing higher efficacy in reducing egg count and cure rate. So, what does Healthyi aim to do to mitigate this issue? First, education and awareness. We attempt to reduce the risk and contamination rate of NTDs by enlightening the locals and thus building awareness and funding for them by publicizing NTDs. Second, intervention. Most importantly, provide the basic medication needed to support recovery, decrease mortality rates, increase community participation, and, in the end, help the locals become productive members of their society. Our first mission of strategic planning aims to provide impoverished communities around the world with basic medication and care to people who need them most. Our second mission is program coordinating, where the creation of education materials through student collaboration, such as brochures, YouTube channel videos, and cartoons, take place. Our last mission of marketing involves the creation of marketing tools and channels, and most importantly, promotional materials such as our website, YouTube videos, local advertisement, and newspaper articles. So, how far have we come with these missions, and what are our future plans as of now? Our project can be broadly divided into 3 parts: pre-implementation, implementation, and post-implementation. Stakeholder engagement with the Kaduna State Ministry of Health takes place first, following the identification of the intervention community. Our first target community is the Kaduna State of Nigeria. This brings us to the next step, implementation. In the implementation phase, using the community and school-based model, we plan to mass distribute the drugs to the affected community and start the education and awareness campaigns afterwards. Lastly, the post-implementation phase, which we haven't reached yet, aims to focus on monitoring the progress of our project and start research for the next intervention community. We'll end this presentation today with taking a brief look at Healthi's organization structure. As reflected in our 3 missions, we have 3 main teams called Program Coordinating, Strategic Planning, and Marketing, which are also divided into smaller groups. I hope that this presentation has contributed to a deeper understanding of our organization, Healthi. Thank you.